Hey, I'm Molly Sims.
And I'm Emese Gormley. We're two girls obsessed with one thing, beauty.
And by that, we mean everything that makes you look
And feel
beautiful.
We're calling on our favorite health experts, industry insiders, and friends to answer all your beauty questions.
With a drink in hand.
Definitely with a drink in hand.
You're listening to Lipstick on the Rim with Molly Sims. Well. I have to say, very excited about today's guest. It's near and dear to me.
You know, I always think these are the best episodes because they're personal and professional.
Mm-hmm. I have worked with our next guest off and on for probably 5-6+ years. I, as you all know, have had really bad back issues, hip issues, and I am so happy I talked him into doing this. We have Dr. Jason Snibbe. He's globally recognized. He's a board-certified orthopedic surgeon. He's a true pioneer in our field. We call him the orthopedic to the stars. He believes in empowering patients through compassionate care and accessible knowledge. You might have seen him on CNN, Good Morning America, Hulu, or heard the name dropped by one of your favorite celebs. He is the orthopedic surgeon to the Kris Jenner, to the Kardashians, to Phil. We wanted to have you on today. So listen, a quick little story. When I was figuring out what the heck was wrong with me, I remember going to Dr. Snibbe and he's like, I don't think it's your hips. And I remember sitting in there because I was very nervous. And I'm like, I've got this pressure in my back and it's not going away. And you were so amazing and thoughtful. And you spent time with me and you're like, I just don't think it's just your hips. Anyway, it ended up being my back. And then now it's my hip. So we cut to a few weeks later. But okay, we're going to take us back a little bit. How did you become Jason Snibbe? Like you know, what's crazy is that the Clippers, as we all know, NBA, like you are the team go-to doctor. You work with you work with all of these incredible athletes. Like, how did this become?
Yeah, great question. It's such an interesting journey, but it happened because of a lot of things. I think it was right place at the right time, but a lot of it happened because I trained here in Los Angeles and I worked with the famous group called Curlin and Job, and I trained there and learned from them kind of how to manage athletes, how to manage celebrities. But there was something about taking care of people on a personal level that I always had a way about me, that like I felt like I always want to know about the person, like who is this person, no matter who they are, whether they're a plumber or they're a celebrity or they're an athlete or they're just a regular lawyer in town. To understand somebody's goals, like what they want to do, and also kind of how their problem, their hip problem, their knee problem, their shoulder problem affects them on like a day-to-day basis was always my goal whenever I talked to a patient. And I think because I had that kind of altruistic outset on the outset of my practice, a lot of people said, this guy is taking care of me in a different way. And that's how I started my practice. And I told myself I'd never change that from day one and till now, 20 years later.
But you lead that way. He'll take you in, he'll sit you down. Mm-hmm. Of course, I lead with, am I going to die? Or I'm never doing that. Yeah. No, but I mean, listen, I've had injections where he uses a needle the size of my arm that I think I'm going to faint. But you really do have that personable way about you that your nerves kind of, go down a little bit. You ask, which I love, is that, how bad is your pain?
Yeah.
Like, can you live with it? You ask very specific questions. Yeah. Do you remember your first athlete or celebrity that you're like, wait a second, this is me. I'm your guy.
Yeah. I mean, I think there's been some moments where the person is asking me questions and I'm thinking to myself, like, I can't believe I'm sitting in front of this person right now that like I've watched on TV 100 times, or I listened to their music as a child, or like I did. Like a great story is when I was a little kid, I was in kindergarten and my buddy had an older sister. and we loved her. She was like in sixth grade. We were at kindergarten. She was sixth grade. We all had crushes on her. And I remember she had back then we had vinyl. She put a vinyl record down and she played this song, and it was the Go-Go's.
Oh,
and I remember listening to that music, and I said, I don't know what that is, but I love it. It's the most amazing music. And then flash forward like 15 years ago, guess who's in my clinic? Belinda Carlisle.
No, stop.
And I ended up, doing several surgeries on her, different types of surgeries. And she's been a great fan of mine and posted on all over social media about me. But I'm sitting there in front of her and I'm like, I loved you. Like you were like my crush, you were like the biggest thing, and the Go-Go's were the biggest thing for me, and now this is my patient now. And it's amazing how it just transforms. And sometimes I think to myself, like how many people have come through the office.
And I also think too, as well, it's like, these celebrities, these athletes, people, they're scared because they're coming in. You're not seeing if you've made it to Dr. Jason Snibbe,
you've made it.
You need help. Yeah.
You need help, or you're worried about something. So I'm sure it's like, for me, I'm like, or my husband, he's going to do a hip replacement with Snibbe, but there is that fear. There is that. And I think you do a really good job of listening to the patient. Where are they? How much pain they can live in. And you make us feel confident. They're like, okay, we can do this, because surgery's scary.
Yeah. And I think one of the biggest things I tell patients kind of at the beginning is that, like, I'm going to be there the whole time. You have me from the beginning to end. I will ask, you can ask me the dumbest questions, the most simplest questions, the most complex questions. But also, it's important to educate patients about the surgery, because the surgeries that I do are strong. Like, people are like, I'm worried it's going to break. I'm worried it's going to fall apart. I'm worried if I trip or I turn a certain way, it's going to explode inside of me. And I have to tell them several times before the surgery, this is strong. You can't mess it up.
Okay, let's talk a little bit about that. Is everything done robotics? Is it all robotic now?
So in joint replacement now, hips and knees are done robotically. Not every surgeon does it robotically, which I think is a travesty to the technology. A lot of people everybody hasn't embraced robotics, but robotics is the way the world is moving. So I do every hip and knee replacement robotically. Shoulder replacements, the robotic technology just came out. Robotically has transformed our field because it takes what we do and makes it so precise and so perfect. Like, I tell patients, it's like, if you make me draw a circle 10 times, the circle will be a little off every time. If a robot draws a circle every time, it's perfect every time. So it allows us to know exactly where we are during the surgery at all times, and there's no guessing game. We know exactly where the implant should go, and it'll allow me to put it there in the perfect spot every time. I also talk about anxiety. So we have anxiety as surgeons, right? So your husband comes to see me. I want to make sure his surgery is perfect, but then he has a great surgery and he goes, listen, my brother-in-law needs a surgery. I want you to do a surgery. And so for us, we're like, I want to make sure I do his surgery as well as his surgery. The robot is like a roadmap.
But what about with robotics? I think it's changed also a lot of the recovery. And I think that there's a lot of fear for people, whether you're 45, 55, 65, or 85, to do these big surgeries. How have these advancements really helped speed up the process with which people recover? And how can you say, don't be as afraid, it's not the same surgery that it was 20 years ago?
Yeah, I think it's a great question. I think that, the accuracy of understanding where you are. So before, you had to make a big exposure. You had to cut a lot more tissue, cut into the muscle, cut all that stuff to see everything, and use different alignment systems to kind of understand where you are. Now you have a small incision. And when I do hips and knees, I don't cut any muscle. And so when we don't cut any muscle, you don't have to expose the whole joint to see everything. Because when I'm putting that implant in, even if your pelvis moves a little bit in a hip replacement, I know exactly the position of the implant where it needs to be. And if your pelvis was to move like 1 degree this way or 1 degree that way, the robot will adjust for that. So you know exactly where you are. Also, when you're doing a surgery, you're removing bone. The robot will not allow you to cut things that aren't supposed to be cut. It's called haptic technology. So I'm a bit, you were asking me how tall I was.
Yeah, he's 6'4".
I'm a 6'4" guy. The robotic arm, when it's cutting and doing things, if I lean my entire body weight, try to push it as hard as I can past a certain point, it won't allow me to do that. And so because of the haptic technology, think about it. When you're doing let's say a knee replacement, you use a saw to cut the bone. That saw will leave the bone and it will injure tissue around it. The robot does not allow that saw to exit the bone. So the tissue doesn't get damaged. So it's an amazing technology that allows you to do things where you don't have to use all these external things to figure out where you're at.
Now, dumb question, but I'm sure on many people's minds.
Yeah.
What if the robot fucks up?
It's a good question. So it hasn't. If the power goes out in the operating room, right? People ask that all the time. There's a backup generator system in every operating room in America. So if the power goes out within 1 second, the generators kick in. The second thing, let's say you're doing the surgery and you make a cut and the robot goes out. You can actually turn the robot off and turn the robot back on, and it will remember exactly the spot that you were at before.
Say you're the patient, you're in a lot of pain, you're not sure, you've come to you. Do you put them on a regimen before you get to surgery?
I mean, there's a lot of conservative treatment that we do before you end up with an operation. But I'll talk about like supplements first. So the supplements that we talk about typically that are great for joints, one is turmeric. Turmeric is probably the best natural anti-inflammatory that exists. The second thing is fish oil with omega-3. There's a lot of data that fish oil with omega-3 is great for joints, great for the health of the cartilage, and for the lubrication of the joints. The other one is collagen. You know, there's a brand called Vital Proteins
We
that
love.
everybody uses. Yeah, fantastic. That supports, everything is made of collagen. Your cartilage, the bones, your ligaments, your tendons, it's all collagen. So the more collagen support you have, the better. And I think that the biggest issue I think that exists with joints and as we age is blood flow. The blood flow to your tendons, to your joints for healing is not great. And so that's why when your 15-year-old kid sprains his ankle, and after 2 days, the kid's sprinting down the road, we sprain our ankle 3 months later, our ankle still hurts, right? We just don't heal like we used to. So it's all blood flow. So everything that is in modern day, some of it's controversial, and we can talk about it, some of it's mainstream, is to increase blood flow to heal areas. And one of those things is PRP. So PRP stands for platelet-rich plasma.
And this is everywhere. We're talking, you know, for people with their hair, people with their joints,
Absolutely.
people,
I did it under my eyes.
Cosmetics under their eyes.
Exactly.
PRP.
And so PRP is where you draw blood from your arm, you spin it down, white blood cells, red blood cells go away, you take the platelets, and they have all these growth factors in them. And there's multiple growth factors that promote angiogenesis, basically increased blood flow to the area. It's kind of tricking the body to say, hey, I have an injury here, come heal it. And we use that in our field for many things. We use it for osteoarthritis. We use it for tendinitis. We use it for inflammation, all kinds of things, all over into tendons, into the actual joint itself.
So that's what you've done to me a couple of times.
And I've had great success with it. And I use it all the time. I mean, in a clinic, typically I'll do 5, 6, 7 PRPs in a day because it works very well. The other thing that we use also is a thing called hyaluronic acid, which is basically a synthetic of the natural lubricant that's in your joints. And so sometimes we combine, depending on the situation, like sometimes if people have really bad arthritis, I'll do PRP and hyaluronic acid together. Sometimes I just use hyaluronic acid on its own. Depends on the arthritis, where it's at, kind of the staging of things, you know?
This podcast is presented by the all-new Dry Bar Blowout Defense Collection, game-changing hair products that prep for a gorgeous blowout that lasts up to 96 hours. The one thing about me and Emese, we really do love our blowouts. Honestly, I'd rather get a blowout than have my makeup done. So Emese and I have been on a mission to master the at-home blowout. And you guys, we have found a whole line of products literally made to make your blowouts better. It's called the Dry Bar Blowout Defense Collection. There's the Blowout Accelerator Spray, which is so good. It's a spray that you put on damp hair before you start styling, and it literally cuts your blow dry time by 32%. It's insane. Then there's the Blowout Defense Strengthen and Extend Shampoo and Conditioner. These not only help lock in your blowout, but also hydrate, strengthen, and minimize coverage. Dry Bar knows when creating your own blowout at home, it's nearly impossible. By the time you've made it into work or shown up at your date, your blowout has already fallen. That's why Dry Bar created Blowout Defense Collection to ensure your blowout lasts up to 96 hours so you don't have to redo it every single day. Use the Blowout Defense Shampoo, Conditioner, and Blowout Accelerator Spray with your favorite Dry Bar tool, which I love, and you have a blowout that lasts up to 96 hours. It is not get ready with me, it's stay ready with me. Get a gorgeous blowout that lasts now and shop Dry Bar's Blowout Defense products at drybar.com.
So I have a question for you because I actually was at a sports parking lot. Do you think and do you see, I think sports has become a lot more prevalent with younger kids.
Yes.
And a mom was saying that her daughter had gone at, I want to say she's maybe about 15. I might be off by a year or two. But showing signs of arthritis from so much sports.
Yeah.
Is that something you are seeing at all?
Yeah, I think that the youth sports right now, the overuse in youth sports right now is very high. I mean, like, I remember I took care of a water polo player once, and I was talking to him. I'm like, okay, when are you going to go on vacation this summer? He goes, vacation. He goes, I play water polo year round. I take 2 weeks off a year to not do water polo. I play water polo all year round. I mean, when we were kids, you would play football in the fall and you play baseball in the spring. And other than that, you would just play pickup sports and casual things. That doesn't exist anymore. Now it's like, what sport do you play? And you're going to play that intensely
all the time,
year round.
Well, you're seeing, to your point, you're seeing these 13, 14, 15, 16-year-old kids have Tommy John surgery, which is a elbow, right?
Yeah, that's like a ligament reconstruction of the elbow. Absolutely.
To hear of that age of a child have arthritis, I was like, wow. But I guess it's repetitive movement over and over and over again.
And you're seeing, and what you're seeing is like, I just got a call the other day from a patient of mine that now lives in San Diego. He's like, my 15-year-old daughter had an ACL surgery and they had to take out her entire lateral meniscus. She has no meniscus in her knee. And so it's like, she needs a meniscal transplant, which is a big surgery, but it's like that's what happens. These young kids, they have overuse, they train. I also think that in the youth sports space, we are not focusing on a lot of strengthening and core and having the right kind of like training for them, you know? And I think that there's a lot of data saying that like young kids are just not training as well. They're not working on their glutes. They're not working on their core. They're not doing things for injury prevention. And in our field, there's been a huge push, especially in women, because women have a lot of ACL injuries that are non-contact. Meaning that women have a very high propensity of like, they'll just be running down the court. No one will touch them and they'll blow their ACL.
Oh my God.
It's so interesting. And why?
And a lot of it has to do with their mechanics. Like sometimes it has to do with how weak their hips are. So sometimes their knees kind of collapse in more a little bit because their hips are not as strong. And so we've found in the research in our field that by training these women to get their glutes stronger and work on their core and work on the more core musculature, there's a less of an incidence of ACL injuries.
Well, thank God, because I think now, like so many women before, and me included, were afraid to do strength training.
Yeah. I mean, when you talk about longevity and you talk about what makes your body the best for longevity, it's muscle. The more muscle mass you have as you age, the better you'll be. Because the more strength you'll have, the more ability to do that.
Would you say running is one of the hardest things you can do on your body?
It is. And I think that I think there's a genetic component to running. I think there's some people that are built for running, because you see these guys that are like, some men and women, they're like 60 years old. They're like, I run, 40 miles a week my whole life. And then you see other people where they run 10 years and they end up with a knee replacement.
Mm-hmm. Okay. We're going into surgery.
Okay.
Are there certain things that you would tell, I know you tell your patients, but just so you can tell our listeners, what do you need to do? Let's start we have the surgery, and then post. Are there certain things, I want you for 3 months to do X, Y, and Z?
Yeah. So this has become a massive area in my field of nutrition and what we call it perioperative nutrition. Perioperative means around the time of the surgery. So there's been a lot of research done by NASA about astronauts that go into space and muscle loss, right? So
we just actually saw it recently.
Oh yeah,
on the news with
exactly.
The women.
Yeah, exactly. So what, there's no gravity, so you lose a lot of muscle mass. So there's a lot of data on basically amino acids, like taking amino acids to prevent muscular loss, because amino acids are the building blocks for your muscle. So there's a lot of different companies that are using them. I take amino acids myself. I take one called Perfect Amino. That's the one I take. There's very different brands, but basically the regimen is for like a week, approximately a week, 7 to 10 days prior to surgery. You should take some amino acids, like a dose of amino acids before the surgery within your water. And you take that prior. Then the second thing is that when you have surgery, what do they tell you? They tell you can't eat or drink after midnight, right? Mm-hmm. The problem is then you're showing up to surgery, you're completely hypoglycemic, your blood sugar's low, you have no caloric intake, you are dehydrated, you're in a bad way. And then you have the surgery, and then by the time the surgery is over and you go to the recovery room and you get to your room, it's a long time.
10 hours.
It's 10 hours. And so now you're completely behind the 8 ball as far as your nutrition and carbohydrates. So we like a patient to carbo load, almost like, when people run a marathon, they eat pasta and stuff like that. You don't have to eat pasta, but you have to have some kind of carbohydrate. Some people are advocating a carbohydrate drink, like something that you would put in, like you would take before a marathon or something like that, where you take that, but basically loading carbohydrates. And the second thing is also taking amino acids the night before. And the morning of the surgery, as long as you're about 3 to 4 hours before the surgery, is drinking some clear water, like just hydrating yourself.
And you're allowing that now?
You're allowing that at 3 to 4 hours before the surgery, as long as it's clear liquids. Mm-hmm. And then after the surgery, you continue the amino acid regimen for 2 weeks. And then the other thing that's very important is also just regular protein. The building blocks to heal you is protein. So I tell patients, whatever you like protein-wise, whether you're vegan or not vegan, fish, salmon, whatever you like to eat, for all of that is extremely important. And then hydration is very important. Staying super hydrated.
Now, you said you take amino acids all the time.
Yeah.
I do. I take it because to maintain muscle mass.
So
right?
Should women take it all the time?
I think they should. I think that you should put a scoop of amino acids in your
protein shake.
Yeah,
we love it, shake. Like with the turmeric, with the fish oil, the omega-3, the collagen. Yeah. I'm going to do that.
Yeah, you should put a little bit. I take a bottle of water to work every day. I put a scoop of amino acids in it, and I do that every day just to help maintain my muscle mass. Because, I'm 52 now, my muscle mass is decreasing. Every year my muscle mass will decrease. It's just the way it is.
Yeah.
And so you want to maintain that.
Muscle recovery.
Yes.
A lot of women, as they age, have problems with muscle recovery. Do you have any ideas of, and again, or the pain, like I will cheat sometimes and get the cortisone, what did we do? The cortisone shot?
Yeah, we did one.
But what I love, you're like, we got to reduce this inflammation. Now we talk a lot about what does that actually mean when you're reducing the inflammation? I said, I took the Celebrex or whatever for 2 weeks, and I'm like,
anti-inflammatory.
It just kind of calmed everything.
Yeah. So there's some people that some people have diseases like rheumatoid arthritis and certain autoimmune diseases that causes inflammation in their whole body. They take crazy anti-inflammatory medications, and that's the whole podcast in itself.
That's Dr. Baker, Susan Baker.
Yeah, that's Susan Baker. Exactly. That's a Susan Baker event. But a lot of times when you have inflammation around a joint, it can affect the muscles around the joint. It can affect the tendons, the tissues, and it can also affect the way you walk. So like, let's say your hip is bothering you. Guess what? Your back is going to hurt. You know, I always tell patients, nobody walks into my office with a hip problem without a back problem. Yeah. And so they're affecting their back, they're affecting their whole body.
Well, that's the whole reason. You're like, you think this is your hip. And I remember you saying it's 70% your back, it's 30%. You said that to me 10 minutes in, he goes, it's not. But that's the way your mechanics work. I always say, you're not just a hip, you're the whole body, you know, you're the whole body. And so a lot of times we use medication like anti-inflammatories to help lower inflammation and calm things down so the patient can kind of come out of it and say, okay, I'm back. Now I can go work out and go do the things that I want to do. Is it better to take like an Advil or Tylenol? What's better to take?
You know, Advil, Aleve is better because it's anti-inflammatory. You have to be careful because it can affect your kidneys and it can affect your stomach, right? So if you take a lot of Advil, it can put a hole in your stomach, you get an ulcer. If you take a lot of Advil, it can hurt your kidneys. So moderation is important.
What does that mean, a lot of? Because like I go through periods of time where I have bad neck pain. I hold all my stress in my neck.
Terrible neck pain.
It's gotten a lot better, but yes, it's very bad. I suffer. I mean, she knows. I complain about it all the time. So when I have it, I take Advil, and my husband gets on me, and he's like, "Stop taking so much Advil." Yeah. So how much is too much?
Bad to take?
It is bad to take. I mean, I'm talking about taking it for several months, you know? No. But sometimes the way I like my patients to take it is like for just a couple weeks. Like you take it for 2 weeks and then you stop. Yeah. And if you have a flare up, you take it. But it's important also to take it for 2 weeks because you build up a level in your bloodstream. Because some people say, well, I took an Advil on Sunday and I took an Advil on Wednesday and it didn't work. I'm like, it's not going to work that way. You got to consistently take it.
Oh, that's interesting.
I didn't know that either.
What workouts do you recommend to help with your joint longevity? Like, is it Pilates? Is it yoga?
I'm a massive fan of Pilates. I think Pilates is one of the best exercises that exists. The problem I have with yoga, there's people that do yoga and love yoga. I have many patients that are yogis and they love it, and that's great. The problem with yoga is it takes your body to extreme ranges of motion.
I know.
And some people just can't go there, right? Like, I think of a funny joke. My wife and I were on vacation once, and she made me take a yoga class, and I'm not super flexible.
You're 6'4".
And she took pictures of me, and they were like, she sent it to all my friends, making fun of me. Like,
she's someone I want to hang out with.
And all my friends say, Snibbe's not made for yoga. But that's the thing, is like, I've done all the exercises because I like to, as research, to understand it. But I think that Pilates is the best because the core is so important. Your abs, your glutes, all these core muscles, getting them as strong as possible is so important for your entire body. Because, you know, people used to have knee pain. When people had knee pain, they come to orthopedic surgeons and say, ride the bike. But guess what? When you're on a bike, you don't work your glutes.
At all.
Your glutes at all. And so
people think you work your glutes. You do not on a bike.
I mean, maybe if you come out of the saddle a little bit, but you do that maybe like for 4 seconds, right?
If you're trying to be Lance Armstrong, then yes.
Exactly. But working your glutes and working your core is the key. I also think some level of weight training is extremely important. We talked about bone health, but also to maintain the strength of your body and to maintain your muscle mass is very important. But it's very important always to do lower weight, higher reps, just not to stress, because as we talked about blood supply, the blood supply to your tendons in your body diminish over time. And so if you take somebody like me, someone in their 50s, and you put them in a weight room lifting heavy weight, something bad's going to happen. You're going to tear your rotator cuff. You're going to tear your pec. Something bad's going to happen.
I want to debunk a few of these common misconceptions. Only athletes get joint problems.
Not true. Everybody gets joint problems.
You can only get one joint replacement.
No, you can get many joint replacements. So sometimes people have joint replacements that go bad and we have to redo them, right? Or they have an older implant that needs to be redone. But I've had many patients. I have one patient who I've replaced both his shoulders, both his hips, both his knees.
Stop it.
Absolutely. Yeah.
This is one of my favorite ones. Cracking your knuckles causes arthritis.
Not true.
But can we not tell Brooks that? Because it drives me to the brink of insanity.
I just cracked mine.
He loves doing it. I'm like, your knuckles are going to get bigger.
Yeah.
Knuckles are going to get bigger.
It's basically releasing negative pressure in the joint. I don't think it causes any problems, but if you do it like obsessively, you're probably going to get some pain because you're just like stressing your joint over and over and over again. But I don't think you'll get arthritis.
Rest is always best for joint pain?
No. Motion is key. So your cartilage in your body, it has water in it. And when you move your knee back and forth, water is being pushed in and out of the cartilage like an ebb and flow, like the tide. And that is critical for the health of your cartilage. For example, if you put somebody in a brace and left their knee still for 2 months, the cartilage would get destroyed if you don't move the joint. So movement is the most important thing for joints. And the more you move, the better.
We're going to do a little rapid fire.
Yeah.
Surgery song of choice in the OR.
I'm a huge Chris Stapleton fan.
Oh, we love Chris Stapleton.
So that's my favorite.
Are you a morning person or a night owl?
I'm a morning person.
Favorite recovery tip no one talks about?
Heat. Heat is very important. Everyone always focuses on ice. When you ice a joint, it's important to do that after surgery, immediately after surgery. But warmth loosens up the tissue, loosens up the soft tissue and makes the tissue more pliable. And using heat, I tell all my patients after the initial recovery of a week or two, I want you to warm it up. Sauna, jacuzzi, heating pad. The more you use heat, the better.
What do you think about the infrared sauna and the cold plunging?
Great question. There's been recent data, I do it myself. There's been recent data saying that cold plunging can have a negative effect on your muscles. So because, part of the way your muscles grow, like when you go work, let's say you work out this morning, if you go immediately into a cold plunge, they think that the natural recovery of your muscles to regain strength and kind of heal is affected by that. So I think it's probably not good to do cold plunge right after you work out, maybe at the end of the day or in the morning when you're not going to work out. Maybe you can work out in the evening. But I think the data on the sauna is incredible. The sauna is so good for your body, for healing. There's lots of dementia. There's lots of discussions about dementia and heart disease and all that stuff. But for your joints and your muscles, it's amazing.
What's your biggest vice?
Golf.
I knew that.
Yeah.
What joint gets the most attention in LA?
Oh, good question. I think it's probably a tie between, I see it all between the shoulder and the hip and the knee, but probably the knee is probably the most.
You have a shoe company now.
I do have a shoe company. Yes.
This is kind of amazing. Okay, you guys are going to go to www.drjasonsnibbe.com. He's actually going to give us 20% off, so lipstick 20. But tell us a little bit about it. I have mine here.
About 6-7 years ago, a friend of mine who's a chef came up to me and said, he called me up randomly and says, "Hey, Snibbe, you want to start a company of shoes?" And it's funny because my wife for many years kept saying, "You should have a shoe company. It'd be a good idea for an orthopedic surgeon to have a shoe." So I said, "Sure, let's do it." So we went down the rabbit hole and we had a lot of different names, but actually they came up to me and they said, "We want to do a parody on your name and we want to call it Snibs." And a lot of my friends call me Snibs, like as a nickname. So we started a company. It's basically a shoe for people that work on their feet. So chefs, nurses, cameramen, anyone that works on their feet, but they're on their feet for a really long time. And there's different versions of the shoe. We have shoe that's really intense, like for the operating room or like as a chef that is, a knife won't go through it. It's waterproof, slip proof. the shoe that you just showed is called the Rover, which is more of our casual shoe that you can wear outside of the intense environment. But it's great. I mean,
they're so comfortable, you guys.
Snibs. It's a great name.
Snibs. Just remember, Lipstick 20. You're amazing. You guys, everybody follow at Dr. Jason Snibbe, SNIBBE. You can, get in touch with him on his website, drjasonsnibbe.com. Just show up on 3rd Street, go to the 9th floor. he's pretty much always there
all the time.
Or he's playing golf.
Yeah, exactly.
No, it's so, we wanted to have these episodes because I think there's a lot of fear just around orthopedic surgery, like what to do, when to do. And so many of my friends are like, oh my God, I hurt my back, I hurt my neck, I hurt my arm. Maybe it's just the age of where we are. But I think more and more people are really starting to talk about, what can I do? And then ultimately, if I have to do the surgery, but like, what's the pre? What can we start 100%. To focus on?
And we that space of educating patients in that space of prevention and try to maintain things. And people think all I do is operate all day long. I spend a lot of my time educating my patients on all these things, on like, this is what you need to do. You need to get back. They say, I used to do Pilates a couple of years ago and I stopped. I go, you need to go back and do that.
Yeah.
You go back to Pilates and get in there and do it. Make it happen. I mean, we even put a Pilates studio in our building because I believe in it so much.
We always ask every guest before they go, if you could give advice to your 10-year-old self, what would it be?
Advice to my 10-year-old self. Don't worry about the small things in life, because it doesn't really affect you in the long term. And whatever plans you have in your life, wherever you think you're going to end up, if you don't end up in that specific thing, life has better things to offer you in your journey in life. I always thought in my life I'd end up doing this and then doing that and doing this and do that. And I kind of ebbed and flowed with what the world gave me. And I think that bode well for me I became very successful in my career, but by not being rigid about what I wanted to do, I kind of felt the environment and kind of saw what was available to me, and I took advantage of it, and it paid off for me. And I think that some people get very rigid with they're like, I have to do this and I have to do this. I have to go to this school and go to this place.
Well, you see it. I mean, you have a 13-year-old, I have a 12-year-old. You see the pressure of getting into the schools, and we're like, that isn't.
It doesn't mean anything.
It doesn't mean anything.
It's all going to work out.
And so much pressure is put on these children. You're amazing.
Thank you.
Make sure and follow
Dr.
Dr. Jason Snibbe. Make sure and keep asking questions. Guys, don't forget to rate and review us on Instagram, TikTok at Lipstick on the Rim. We also have our full episodes now on YouTube. Make sure and DM us and tell us. We get a lot of our episodes from our community, from our listeners. Thank you.
Thank you for having me.
It was nice to meet you finally. I feel like I've heard your name a lot.
Thank you. It's a pleasure. Pleasure to meet you.
Get your snibs.
Get your snibs, guys. Make sure Lipstick 20. You guys are going to get 20% off your purchase at drjasonsnibbe.com/snibs-shoes. You're the best.
Thank you.
See you guys next week. Thanks for listening to Lipstick on the Rim with Molly Sims and my ride or die, Emese Gormley. We are so excited to bring you guys along on this journey with us. You can find us on Instagram and TikTok at Lipstick on the Rim and at Molly B. Sims. Or you can go to my blog where you can dive just a little bit deeper into my favorite products, trends, and more at mollysims.substack.com. And don't forget to check out our video episodes on my YouTube channel, Molly Sims. This podcast is a production with Sony Music. I wanted to give a special thanks to my team, Rosie Cummings, Kenna Ryan, Safin Kevorkian, and everyone at Sony Music. Don't forget to listen and follow wherever you get your podcasts so you never miss out on the fun.